and namaste to my lovely viewers and lovely listeners. I am Dr. Anushruti and I have a very special guest on board with me. Today, it is Dr. Allan Phillips from USA joining live, who is a physical therapist and is into US Army Reserve as a doctor of physical therapist. He helps people find real injury solution. He also performs underwater stunts. Hi Phillips, how are you?
Good. Thank you. Thank you, Dr. A, for having me on.
Thank you so much. That is our honor to have you on board. First and foremost thing, what exactly is physical therapist?
So physical therapy is, or a physical therapist. So in the United States, we call them physical therapists. Throughout the world, more commonly referred to as physiotherapist or physio.
Yeah.
And it is a very broad field, but basically it boils down to helping people function at their maximum ability. Physical therapy exists within a wide variety of realms, and most people are familiar with the musculoskeletal realm, so bone injuries, muscle injuries, those type of things. But it also exists in the cardiopulmonary realm, the acute care, or intensive care kind of realm. There's kids, there's even animals, but all of it is basically geared towards helping people function at their very best, to live, experience life at their very best.
Ellen, there is one myth, and I won't say a myth, but yeah, there is some consideration in people that physical therapy usually involves using uses of modalities like IFT, TENS, and ultrasonic therapy. But we all know that physical therapy is a lot more broader, career and broader aspect of healthcare. So, what do you wish to speak on this? Like, what exactly physical therapy uses as a treatment option?
Yeah, so it's interesting you mentioned the modalities, because I went into so physical therapy is actually a second career for me. So I originally started as an attorney in the legal field, because when I was coming out of university, or when I was going through university, physical therapy wasn't even on my radar, because it wasn't, my experiences with physical therapy at that time was pretty much just ice and hot packs and ultrasound. It really wasn't anything to get very excited about. And then fast forward 10, 15 years, and my exposure through some of my athletic pursuits led me to some very inspirational physical therapists and other rehab professionals. And it was a completely different world. There was aspects of very high level exercise. There was neuroscience. There was all these different things. And it was like, wow, this didn't seem to exist when I was going through university level. And so that's when I pivoted and made the career change. But basically seeing that there's all these different things, as you alluded to, there is this myth that physical therapy is just ice packs and hot packs and modalities, and certainly those things can play a role in supplementing really the core of things, which is getting people to move at their very best, and often that takes the form of exercise interventions, but essentially it all boils down to movement. And you can get very deep into not only just the mechanics of movement, but also the role of building self-efficacy in people. So not being dependent on, I need this, I need this particular modality to function. And certainly, as I said, it can, these outside things can help speed the process along, and they can play roles in dealing with inflammation and in-tissue injury. But ultimately, it's the responsibility of healing is ultimately on the individual. It's on the patient, and basically taking control of not only just the aspects of their life in terms of moving, but also just realizing, hey, this isn't like, because a lot of people have this idea like, there's this injury and I have no control over it, and I'm just powerless. But in reality, they do have lots of power, and that's part of our job as the medical professional, whether it's a physio, whether it's a medical doctor, to not only give the people the tools to build that self-efficacy, that independence, but also frame things in a way and helping them as a first step realize that, hey, you aren't powerless. It's not, hey, I have this this disc
Certain
is
pain, yeah.
right. There's not this external this external force that's has us handcuffed in a sense.
So, can we say that patients and clients and general people who have no underlying conditions can approach a physical therapist? Or is there a need for them to have a particular injury, particular or specific pain? Like what? Can they just approach us? Can they just approach their nearest physical therapist for a better health care and for a better health for their body and fitness?
In an ideal scenario, yes, absolutely, and that's really the ideal that we're striving for. I mean, unfortunately, a lot of it is driven by administrative aspects, so insurance and legalities. So, for instance, in the United States, for many years, you needed a referral from a medical doctor
Yeah,
to see a physical
even
therapist.
even in India, we have sometimes in private hospitals and government hospitals, other sectors of healthcare, we do have the system that an orthopedician especially would provide the reference for physical therapist. Like we do have the system that patients directly approach a physical therapist for a certain pain, like for a ligament injury, fractures, or a TKR, THR. So we do have that system, but most of them till now there is something that orthopedician is going to refer them, that go to a physical therapist and do this and that, whatever exercises they prefer, keeping in mind the ailment. And yeah, so I believe you are speaking the same thing.
Hmm. Yeah, and so in the United States, it was, I mean, some of that was a remnant of the system where physical therapy was at the very beginning. It wasn't even a university level degree, but then eventually became a bachelor's at university level. Then it became a master's degree, and subsequently in the last 15, 20 years, it's transitioned to a doctorate degree. And then along with that transition has been what we call in the United States direct access, where you can basically go directly to a physical therapist without needing a referral from a medical doctor for a PA or some
Mhm.
professional along those lines. And interestingly, since you brought up the military in my bio, that idea of direct access to physical therapy was in many ways inspired by the military system, because basically just the logistics of the way personnel is spread out, they saw that but really by necessity, because there are a
Yeah.
lot of musculoskeletal injuries in military population. It was just more efficient to say, hey, just go see the physical therapist, in part because of just the way things were structured, and also because
Mhm.
there's a shortage of medical doctors, and their skills and knowledge is best served saving people's lives, and not having a line of people out the door with ankle sprains. Um, so that's kind of where the whole direct access concept came from. But just kind of general big picture, yeah, it's an ideal scenario. Yes, you would be able to go see a physical therapist directly, because there is actually plenty of evidence, scientific evidence, showing that early intervention with physical therapy for particularly back pain uh, results in incredibly much better outcomes in the long term, versus, if you can imagine the scenario, and some people watching this may have been through this scenario, where it's, okay, I'm doing something, I tweak my back, and then, okay, I got to wait a few days to go see my physician. You go see your physician or your orthopedist, and okay, they write you script to go see the physio, and then, okay, call the physio, and then it's like, okay, well, we'll get you in, and your next appointment is in 2 weeks. Okay, great. And so by the time they've gotten any care, it's been 3 weeks, and they haven't really done anything
Anything.
to care for their back. And we know there's this window of opportunity early on in the injury process, where if you get moving, you get the right kind of care, whether it's exercise, whether it's whether it's some modalities, whether it's spinal manipulation has a lot of evidence in that acute that acute injury setting. So really just early intervention is really the key in a lot of these cases. And fortunately in the United States, at least, there have been some of the legal barriers have started to come down that will allow people to get that immediate care that they need. So some of these these minor back tweaks
Yeah.
just stay minor. It's like, okay, a few days later, okay, great, I'm feeling okay, maybe take it easy for a week or two, instead of being, oh, I wrenched my back and then it just tightens up over the next 3 weeks, and then by the time I get to see the physio, I'm hobbling into the office, when if I had seen the physio 2 days later after the injury instead of 2 or 3 weeks later, then maybe there would have been
The
no issue.
regret.
Right.
Allan, since we are talking a lot about exercises and the role of exercises in physical therapy, so is there any, light in the truth that physical therapy helps you in weight loss?
Indirectly, in that, so let's say you have a severe back pain. If you have severe back pain, then you really can't, it's going to be difficult for you to engage in any strenuous exercise. And so if you can't engage in strenuous exercise, then it's going to be certainly harder to burn calories and keep your metabolism high. So in that sense, yes, that physical therapy can help remove some of those barriers that may stand in your way to movement, whether it's pain, whether it's some specific injury. But going back to the idea of seeing a physio early on in the process, there can be, even if it's not like a serious injury, there's certainly in many sports type of
A sprain or
physios.
a strain?
Right. So just because someone has a sprain or a strain of something, let's say I sprain my ankle, I can still strain my upper body at a very strenuous level. It can still train the other leg. It still train your core. So one good thing that or one thing that physiotherapy can offer is the ability to train around, so not only rehabilitate the injured area or injured limb, but also provide a safe and effective exercise program that works around the injury. So again, let's say it's an injured left leg, you can still train your upper body, train your right leg, and physio setting can certainly help accomplish that safely.
Also, how do you define biomechanics? Like, we often hear biomechanics is physical therapy is biomechanics, we cannot study physical therapy without understanding biomechanics, and biomechanics is an integral part of physical therapy. But the general audience who's listening to us, who are in a sense our patients, how do you define biomechanics for them so that they can keep in their mind about their biomechanics?
So I think the simplest way to put it is that the body is made up of many different joint systems, and they all relate to each other. So I typically describe it like, let's say you have your hip and your hips and your low back. Think of them as coworkers. And imagine a situation where you have coworkers, and let's say one of them isn't doing their job well, or is slacking off. So let's say in the human body, let's say the hips are slacking off. Well, just like in a workplace situation, okay, if one worker is slacking off or not doing their job well, then the person next to them can, at least for a while, they can pick up the load and do that person's job along with their own job. But eventually that's not sustainable. And so eventually the person that's trying to do two people's jobs, they can sort of wilt under the stress of having to do more than they're fundamentally capable of doing. So if you think of biomechanics, like you have all these different relationships of different body parts, and what happens in one area is going to have some kind of cascading effect in another area, and that can be good and that can be bad. Certainly the bad situations if again one area isn't working well, but it can also be good in that when neighboring joint systems are working at their best, then they can allow the muscular system, which is layered on top of the joint systems, to function at a very high level and do very dynamic things like run fast, jump high, and really whatever whatever you want to accomplish.
One question coming up on your way: how can a person avoid going to a physical therapist? In the sense, avoid running for the doctors like having ailments.
So basically, this how can you stay healthy without getting injured? Yeah, so number one
Yeah,
is consistency. Yeah, number one is consistency. So we're coming up on the new year, and one thing, and so at least in the United States, that means a lot of people take time off of their exercise or activity regimes over the month of December, and especially these last couple of months around Christmas and New Year's. And then when New Year's rolls around and everyone gets back into a normal routine, part of that routine includes, okay, I'm really gonna focus on my fitness and my health this year, and which is certainly wonderful. But one of the problems is if you've been off for 2, 3, or 4 weeks and not exercising regularly,
consistent.
right, then take someone who's maybe hasn't done anything for a few weeks, or maybe just been going 1 or 2 times a week, and then they get all this enthusiasm January 1st, and then start hitting the gym hard 5, 6, 7 days a week.
The
Then
so-called New Year's resolution, like every people ought to make some fitness resolutions.
right, exactly, and which is it's the enthusiasm is great, but when it's not preceded by some consistency before, it can get people in trouble. And ultimately, I'll see a lot of those people in February and March after they've kind of beaten themselves down, so to speak, over the month of January, going from 0 to a very 5, 6, 7 days, 5, 6, 7 days a week. So that's one thing. Just being consistent is the most important thing.
Regularity is very important in everything you do.
Yeah, absolutely, and that goes not just for in terms of like the biomechanics of the tissue and all of that being conditioned for the loads that we'd be placing on it in the gym or whatever activities we'd be doing, but also just in building the habits throughout life. So it becomes as part of activity and being an active lifestyle. It just becomes a part of your life. A normal part of your life, and not something that you really need to that becomes too much extra effort. Like if you get in that routine, then it's just okay, this is just what I do. It's not some monumental feat just to go get a little bit of exercise. If you've built that consistency, then it doesn't take as much sort of mental bandwidth to get yourself in there.
Dr. Phillips, we do have a lot of people being a cyclist or a runner. So, how do you wish to guide them as in the case of injury prevention? Like, what are the some basic steps and tips you would gonna give them for injury prevention for a cyclist or a runner?
So consistency, of course, like we were just talking about. The other thing too is making sure your easy days or recovery days are truly easy. One of the biggest problems, one of the biggest pitfalls that many runners and cyclists fall into is thinking that every ride or every run needs to be hard. Thinking that, oh, if I'm not going at my max and I'm not out of breath at the end, then it wasn't a good workout, which is false. You're going to have your easy days, you're going to have your hard days, and just making sure that your easy days are truly those days where you're giving your body a chance to actively recover and let yourself prepare for those harder days. And that would probably be the biggest thing. Also, as we get older, strength training and flexibility training. I know a lot of people get into cycling and running because they don't like the strength and the flexibility part, but
Absolutely.
certainly as you get older, it's an essential part, not only for the biomechanics of the sport, but also just as we get older, as you know, it's once we get to the age of 30, muscle mass begins to decline as a just natural biological phenomenon. So some amount of resistance training is necessary just for the fact of living a healthy life, even irrespective of anything it does for performance on the road or on the bike.
Absolutely. We both know that physical therapy has evolved a lot during these days, and the education of physical therapy has evolved too. Now, we have a lot of aspiring doctors and physical therapy medical students. So, what do you gonna wish to speak to them as a token of motivation? Because, physical therapy is a very long degree in every country. Like, it is not something that you can do like a diploma for 2 months, 3 months, or an year. It actually takes a lot of period of time, energy, hard work, and mindset as well to become a doctor of physical therapy. You have excelled in this career. You have shown, you have proven that physical therapy is a very nice career to opt. So, we have students listening to us, watching us. Please do motivate them by a token of word for them.
So I think the biggest thing is understanding that when you get to work with people, the whole job, the whole profession takes on a different meaning. When we're, especially in the early stages of medical education, a lot of it's just you're just in the books, and you can easily lose sight of the fact that is a people profession, and it can be kind of demotivating when you're trying to memorize all these obscure muscles and structures, and especially if you're in the physio field, you're having to memorize these other organs and different systems that seem like they have no relation to say a sprained ankle. But I will say that all that stuff matters in the end. But going back to the original point, just keeping sight that it is a people profession. But then also understanding that when you do work with people, they don't. There's the saying that they don't. No one really cares. They don't care how much you know until they know how much you care. And so just being like a good person, being attentive. So one thing I've always told myself, especially when I was starting out, is okay, maybe my knowledge or my skill set isn't at the level of an expert who's been doing it for a very long time, but there's still some things that really don't take any expertise or any talent to do well, whether it's just being attentive with listening to people, the things that in the United States we call soft skills. So just caring for the person that's in front of you. I mean, those are types of things that really don't take any specific knowledge or talent. And you can really excel if you do very well at those things, and often excel more than if you have all this book knowledge and don't have the ability to relate it to people, especially in this field of physiotherapy. It's different if, for instance, like if you're a surgeon and all your patients are asleep when you're working with them, then some of those soft skills maybe aren't as important. But certainly in the physio field, it's a people profession. It's a people field. And relating it all to the people and the patients that you're working with is really what it all comes down to.
Definitely. Last but not the least, during these days, especially after coronavirus, after the onset of coronavirus, we have seen a lot of changes in people's posture. They have a hunched back, and sometimes they have scoliosis, kyphosis because of errors in sitting and everything. So what do you wish to speak to them, like how to prevent a bad posture and how to actually carry a good posture from a very young age? Like, we talk about kids and then some younger and older adults.
So one of my favorite cliches is that the best posture is the one that you're not in. So basically, variation is really the key to posture. There's no, in my opinion, there's no bad posture per se. There's just posture that's either done too much or done at the inappropriate context. So like if you're rounding, if you're rounding your shoulders and your kyphotic posture, certainly if you spend all day like that, then yes, that's very bad. But there are contexts where, if you were to sit with, quote unquote, perfect posture all day, then those muscles might get
Become
fatigued too.
rigid.
Right, exactly. So there's nothing, and in for instance, in yoga practice, there's we go through those extremes of the spine, both which in isolation would be deemed bad posture, but as part of a movement practice are very healthy. So I think the key to posture is variety and variability. Also understanding that posture and all of the I guess the emotional and psychological things that have come with the pandemic. Posture is often reflective of
Due to these
psychology.
factors.
Right. So posture is often reflective of psychology. So you imagine if people are sad and down, then that can have them in a very kind of submissive or defensive type of position. So sometimes it's, as professionals, understanding that it's not just, hey, just sit up straight. A lot of times, if someone is carrying themselves in what we might see from a biomechanics standpoint as bad posture, it might be them reflecting something, with their mood or their psychology, and something deeper going on in there. So it's understanding that posture is a reflection of other things, not just the presentation of the muscles as well.
Well, I hope that this is going to be a very big hit, since this is what people were waiting for, to have a token of motivation and to understand what physical therapy is actually. So, guys, also, this is a reminder to straighten your back and have a good posture right now and listen to us very carefully. We have come to an end of this podcast. Dr. Ellen, thank you so much for joining in and putting in your words and all your knowledge regarding physical therapy, enlightening all our listeners and viewers. I do hope you enjoyed it as much as we had listening to you.
Yeah, thank you so much for inviting me. It's certainly an honor to have you reach out from literally the other side of the planet. So it's certainly very flattering for someone all the way around the world, and someone as esteemed as yourself in the field to recognize me.
Thank you so much. Guys, do mention in the comments what video or what topic do you wish Dr. Ellen and me to speak upon regarding to you all. Thank you so much. Thank you for joining in. Stay tuned. Take care. Goodbye and a very happy new year.